Great. So hi everybody. I do know some of you. For those that haven't met me before, my name is Pippa, and I am a physiotherapist by background. I was the lymphedema clinical lead in the South Eastern Trust until February this year, when I took up post as the Encompass lead, and that really long title that Anne-Marie's just mentioned there about being an information officer. So my remit within the South Eastern Trust is to lead AHP direction of Encompass programme, but also I have a wider remit for digital in general, and that's why Anne-Marie had got in contact initially to kind of see if there was anything that I could bring to you, sort of horizon scanning that's out there from a digital perspective that would meet the needs for your clients. So my plan today is to just run through a bit of an overview of Encompass. This is going to be pretty high level, and I'm sorry if you've heard it in other guises before, but do scribble down your questions, put them into the chat box, wait for them at the end, because I would much rather actually hear the questions and things that you want answered, because this will be quite high level. Then I'm going to have a quick chat about things within the trust that are available from a digital perspective that you might be able to utilize. Some of them you will have come across before probably, but just to let you know that they're there and who to contact. And then a little bit at the end about other things that are out there that are available, and then a bit about keeping you updated digitally as well. So those are the areas we're going to cover. We'll get going. So what is Encompass? I think the majority of you work in health and social care in Northern Ireland, so you hopefully will have heard of this. If you haven't, I would be a bit surprised, but you'll learn something here. So it is going to be an electronic patient record for the whole of Northern Ireland, and it's being built with that in mind at the moment, but it's going to go live in the South Eastern Trust next year, in the Belfast Trust the following year, and then Northern 6 months after that, and then Western and Southern are going 6 months after that. So whilst it's being built for everybody, it will be implemented one after another. And it doesn't matter where you work within health and social care, it will be the one thing that we are using. So a lot of the systems that we currently use, Paris, LCID, EDAMS, paper notes, all of those will be going, and we will be using this one electronic record. I'll talk a little bit about more what is in and out of scope later on, but the aim is really to bring everything into one place, because we know how important it is to have information in one place that everyone can access in a timely way, and that really makes things more efficient and makes our care safer and better. You might have heard about EPIC. And sometimes it can be a bit confusing because some people use the word EPIC, some people use the word Encompass, but just to make it really clear that EPIC are the software provider that will be using for Encompass. So Encompass is our Northern Ireland name for the record, but EPIC are the people that are providing it. And the reason why it's called Encompass and not EPIC is because we went through a procurement process to get this system, and we didn't know at that point who the provider would be. Lots and lots of other people use EPIC. They are gold standard at providing electronic patient records, and there's lots of places in the UK that now use it, as well as many across America and the rest of the world as well. So they're really good at what they do. And in America particularly, they just take it out of a box and plug it in and use it. In the UK, it's not so much that way. We do have to do more of the build and design for ourselves, especially in community, because that hasn't really been used an awful lot. It's more of an acute system. So we have to make it work for us. And that's why there's a lot of groups going on at the moment to try and make that work for us. So what does Encompass mean for our patients and service users? So the aim is that hopefully people will have to tell their story less. They won't need to say the same thing to lots of different healthcare professionals. It'll be in one place and we'll be able to look at that, which means that we'll be able to improve the quality and the consistency of our care. So at the moment, we do things quite differently across Northern Ireland. If you go to one hospital, you might get slightly different treatment to another hospital, and that's not ideal. Really, we should be doing the best quality, the best evidence-based care, and this will help us to do that. The really exciting bit of this program is that there is a patient portal attached to it, which is a patient view into the system. It has got some things we're going to need to get our heads around about patients being able to access their notes in some cases. But to start off with, they're going to be able to access a lot more information about them and be able to input into that information, which will hopefully give them more ownership of their care and their health as well. And then obviously the system is really smart. It builds in some safety checks, what they call best practice advisories. So for example, if you put in a high heart rate and a high temperature, maybe a news score that's quite high, it will let you know that that person is at risk of sepsis. Or another example that I can't think of right now, but it can pick up lots of different bits of data from all throughout the system and pull them together to alert you that there may be a problem happening. And what does it mean for staff? So we will have less paper. Things will be less siloed. It will all be in one place, and we won't need to keep repeating it. I was thinking today of an example where I am a non-medical prescriber, and whenever I prescribe something, I have to record it in LCID, I have to record it in my paper notes, I have to open up Patient Centre and record it in there and write the discharge letter, and then I actually have to handwrite the prescription as well. That should really not be the case. We should be doing that once. So hopefully it will then free up more time for us to be able to look after our patients. We should be able to get the information we need about them more easily, especially, those poor historians where you can't get a full patient picture about your patient's history. That hopefully should be accessible through the record, and it should then lead to safer and better care through all of those standardized workflows that we've talked about. So this is just looking at lots of different job areas and professions that may be affected by this different way of working. So the example there for physio is that we save time by not logging into lots of different systems, like I've just said, but there are lots of other ones there that you can have a little read around. Community nurse, I can log into the system to see information about the patient's history in hospital rather than relying on the patient having to tell me, or there being a carer there that can do that. Acute nurse, all the OBS are recorded directly into Epic at the patient's bedside, and that makes it easy for everyone to see. And there's a really lovely tool within Epic. If you're writing a note and you need to know what the patient's last set of vitals were, if you press dot and V as a shortcut, it'll automatically pull in the last set of vitals that were taken for that patient and tell you when they were taken. So we should be able to help reduce down on repetition and things like that too. So a little bit about what's in and out of scope. You can see over on the right hand side there, the blue things are going to be replaced by Encompass. The light blue things will still exist but will interface with it, so there'll be a link through, and then the checker box ones are things that are going to be new. So particularly for allied health professionals, you'll see there maybe in community health there, that will be the likes of LCID and Paris. Child health, maternity, the BadgerNet solution that you may have come across there, those will be replaced. PAS will be replaced. So there's a lot of different systems that we use that will become Encompass. Things that aren't going to be replaced are GP systems. They use the likes of EMIS and Vision, and they're not going to be using Encompass. There will be an interface to it, a little bit like they have access to NIECR at the moment. They'll be able to access Encompass link, which will give them a read-only view of what's in the system, but they won't be recording into it directly. And labs and radiology, so NIPACs, are going to be standalone systems, but we will be able to access them similar to the way we would do through NIECR at the moment as well. So we'll be able to view things through Encompass. And then the checkbox bits are the bits that are going to be new because they come automatically with the functionality from Epic. So that clinical decision support I talked about, being able to flag up issues that are maybe not really immediately obvious, or, things around medication, I can't think of the word, interactions, they will be automatically flagged up, and e-prescribing and medicines administration are all included in it as well. And my favorite is the patient portal. So the functionality we've talked a little bit about, but you should be able to do all of these things through Epic. Request services electronically, so our referrals will all happen within it, that be in wards or from inpatient to outpatient, or from outpatient to community or inpatient to community. That should be all within the one system. All our notes will be done electronically. You'll have your clinical decision and workflow support that gives you alerts and any contraindications and things like that. Medication management, or your ordering and prescribing, will be in there. The patient portal for them to be able to access and book appointments and cancel appointments, that should all be done through the patient portal as an option. They will still have their manual processes in place, but that should be an option. And booking and pathway management, so your scheduling of patients, can all happen through Encompass as well. And then lastly, in the top right there, population health management is another area that's really exciting. This is going to be the first time that a whole country will have its patient records in one place on one system. And that means that the information that we put in, we'll be able to pull it out as well, and look at trends and potentially different areas of deprivation or ill health that we can plot and look at what intervention we need to provide, maybe more proactively rather than reactively. So what does it mean for us as staff? It's obviously going to change the way we do things. There will be a lot to learn. There'll be new devices that we work from, there'll be new workflows and systems to learn. So things are going to change quite a bit, hopefully for the better, as we've seen. And the idea at the moment, as we are moving through the design of this, is that we have subject matter experts that are sitting on the groups, and I'm sure a number of you are those subject matter experts, to really build it to be what we need it to be. Within areas of administration, there is potential that jobs will change really significantly, in that they won't be needed anymore, but there's been agreement in the programme that there will be no job losses, and that those people will be reskilled and used in other ways potentially. And obviously everybody will need significant training to make sure that they're ready for it. And that actually is planned to start very soon in the South Eastern Trust in the new year, so to get everybody ready. There's a little link there that takes you to a video as an overview, and also the website, which is really helpful. So that is the Encompass part over. It is high level, so get your questions ready. And I'm just going to fly through these next few bits here. So you maybe have come across a few digital systems in the trusts that can be used with patients. One is called In Healthcare, and the other is called Florence. And I know Anne-Marie and I chatted about Florence and the fact that they had maybe looked at that. And I know that your client group are maybe ones that might struggle with using technology to communicate with you, or to provide data that can give you an idea of how much input they need. But it's just to let you know that these things are available. And the people on the right hand side there are the technology enabled care managers within the trust. So they're the people that will give you more information about these systems and just what you can do with them, and how and they would be the ones that would organise it if it was something that you thought you were going to use within your service. I wanted to give you an example of how Florence has been used over in England. It's used in lots of different ways actually, and there's a great website, and I will connect the links into this. But I just thought I would pick out a couple that were specifically used by allied health professions. So there's a diabetic foot program that use Florence, and they have set up a schedule for patients to monitor their feet. So you may know that if a patient has got diabetes, their foot care is obviously very important, and checking their skin to make sure that there's no deterioration in the skin, that it's well moisturized, that there's no risk of ulceration or skin breakdown. So skin care and checking your feet are really important. And what they did was they used Florence to send out a text message, or it can actually phone a landline that you can pick up and listen to the message as well, if they don't have a phone that can receive text messages. And it just prompts the patient then to do their foot care and to give them wellness messages. So have you remembered to moisturize? Have you used a mirror to look on the sole of your foot? And then the patient could text back or reply to say yes, all clear, or no, I might have a concern about this particular area. So that's a really simple example of how something like that can be used, but it can be more complex as well. So you can maybe, they have used it in, again, another diabetes example, but prenatally for patients who are entering in their blood pressure and heart rate and blood sugars, that are monitoring those things prenatally, and then that allowed them to highlight which ones they needed to bring in to see, and others that were managing really well and didn't need the appointment. Also on this screen is My Care Record, which is the patient portal that we currently have available to us, which is a patient view of NIECR. Not a huge amount of people know about it, but it does exist, and you can log on and look at the appointments that you have upcoming, and you can also give out patient information through the portal. So that's another area that potentially you could look at developing for your service if it was the right thing. Even align it, you can set up the portal so that you have proxies aligned to it, so a patient can give access to a family member or a carer so that they can keep an eye on appointment times and any patient information as well, or education materials. So that's something else that is available, and anything that is in there will probably link along to the new My Care Record whenever we get Encompass. Moving on then, what else is available out there? So this was just a little bit of horizon scanning. None of these things are available easily through the trust, but I wanted to just give you some ideas of what's available. And I had attended a session recently that was run by Catapult Connected Places, which is the first words on the screen there. Whenever I send this out as a PDF, I'll put links to all of these sites on it so that you can go and find out a little bit more information about them. But Catapult is basically a Homes for Healthy Aging program where they carry out real world testing, and the Belfast test bed that they have is aiming at reducing social isolation and loneliness. So they put out a call to industry, to lots of people out in industry, and they come to them and say, we've got this, we think it would help with social isolation and loneliness, and then Catapult connects those companies up with people that can test it for them, and then they run trials and they see how well it works. And these are all the different companies that have responded to this social isolation and loneliness call. The first two on this screen, Ethel and Connect, are really just devices that help older people to be able to access what we might put on a phone. So if it's too small for them, or if they're not familiar with technology, these are both different ways of using either a large touchscreen device or even their own TV. Connect works through, and there are no sort of complicated steps to go through to get everything working. They're very simple yes or no buttons that people can be very familiar with. So those are just two different companies that provide that kind of facility. You can go and find out more about them if you want to. And then these few companies do different bits and pieces. So Civic Dollars, I'm not sure if you will have come across them, are a really clever company that use geocaching to put fences around natural spaces, virtual fences, and you download their app onto your phone, and when you go into a particular space, a natural space that's got this fence around it, and spend time in there, you earn rewards while you're in that space. So the idea is that you increase people spending time in nature, usually you increase their activity levels, and then you reward them for it. And they have a particular initiative at the moment with the over 65s that gives them rewards like buying a coffee for a friend, and then that increases their or reduces their social isolation as well. Wannatalk is the Uber of finding people to talk to, apparently, and their aim is to encourage people out of their homes to meet people in person. And again, it uses geolocation to connect people up that want to just talk to somebody in real life. And you can go and have a look at more of the details of it on their website, but that's basically what it does to try and decrease social isolation. There's no age limit on that, but potentially it could be used for older people, and there's safety measures around it as well, obviously. Walk with Path is a company that use technology on footwear or in footwear to help people with the likes of Parkinson's or who are at risk of falls, to provide cues for patients. So one of them is, I think it's like a little laser on the end of that you attach onto the end of a shoe, and it encourages those with Parkinson's that get a freezing motion to unfreeze and continue on. And they have a new insole as well that they are working on from a falls perspective. Living in Fitness was a chap from Oxford who was running online low impact exercise classes using NHS guidance, but just bringing people together in community really. So they have a 5-minute chat and they just meet together and do some gradual graded exercise, which is probably something that you can do, but that does exist outside of NHS or HSC as well, as a potential for people to join into and get socialisation as well as some exercise. Thriving AI is an app that brings together people's health and social care systems and provides them with meaningful community participation and updates and connections to family caregivers for reduced stress and peace of mind. There's a really lovely video there, because that description doesn't tell you what it is at all, but I'm going to leave you to have a little press on that video for yourselves. I think it's about a 3-minute video, and it just describes what it does. It's basically bringing people together in a very simplistic way, again, that's useful to help people to connect. And then these next two are particularly used in areas of dementia, or people that have early dementia and are wanting to, their family and friends are wanting to collect their history into one place. So story is done through a phone line, and it rings you and it asks you to tell a story about a time when, and the person on the phone narrates the story, and then it stores it up, and it makes it accessible to people that they want to share it with. And Treasure Book app's a similar thing. It's got lots of different things, like you can collect pictures together. I'm trying to think of everything else that was on the little diagram, but again, that link there will help you. And they're basically just really useful for family members to promote conversations, and they can be used by carers as well. I think there's a collection of music in one of them that people are familiar with, and you may have come across things like that too. And then Companions is an app that is a company that brings together people that want to care, to look after people, and those that need somebody to be with them. So not a carer, not somebody that's going to look after their ADLs or anything like that, but somebody just to talk to and to spend time with, and it links people up to be able to do that. So that was, oh, I've gone back the wrong way. That was just a quick overview of the kinds of things that were available through that. Let me bring that in there. Talk that I went to with the connected places. There's nothing groundbreaking in there, but they may be of interest to you. And the other thing is that I think they're very specific to the individual. They're not going to work for everybody, but there may be some things in there that you know of somebody that actually that probably would be quite useful for. And that's where the difficulty with digital technology comes in. I think there's never a one size fits all. But hopefully there's a few things in there that might be some food for thought about what you could use for your clients. Lastly then, this page here, I just wanted to give you some tools that you could possibly use for yourselves from a digital perspective. So I'm sure you'll be aware of the interactive CSP and the questions that people go on and pose, and then others answers, and that's a really nice sort of crowd-funded way of getting answers to things. Digital Learning Solutions is a really great platform that I think is totally underutilized. If you have an HSCNI email address, you can log in to this platform, and it does a self-assessment questionnaire of your digital skills. And then using that, it directs you to places where you can go and learn about things. So they have YouTube videos for Excel, for Office, and depending on how you respond to it, there's some really brilliant resources on there that can be useful. Orca at the bottom you might have come across, and we have an HSC apps library, and I think it's really helpful sometimes if you're recommending apps, not just to patients but to family members or to yourself. You want to know how good they are, and Orca is a company that rates apps as to how safe they are, how user-friendly they are, how well evidenced they are, and we have a Northern Ireland one where you can go on, put in the name of the app, and they are all health related for our app library, and it will give you a rating on different areas. You can also use it if you are a member, and you can speak to me if you want to be, to directly refer patients to apps or apps to patients, and it gives you a little bit of governance about the fact that you know that they're getting the right one, and also you can see when they've downloaded it, so it gives you some idea around that as well. The CSP have a digital and informatics physiotherapy group. So if you are interested in digital stuff, they're a really good place to go and be a member of. And then on the far right hand there, I don't know if you will have come across Future NHS. Future NHS is an NHS-wide platform that really enables you to have kind of teams, virtual teams, and we have one for digital AHPs in Northern Ireland. I think I'm trying to remember, it sits inside HSCNI Innovation or something like that. But if you click on this link, you will get taken to it. And that's something that I set up in my previous role when I was working in the Public Health Agency, because we had a digital AHP network and we had produced quite a few resources during COVID. So you can see there's some virtual consultation guidance and things like that, and a few sessions that I have done. So that's a place to go to, and I haven't done anything much on it recently, but we will be using it more in the future, I think, as Encompass rolls out too. That's everything. It's been a bit of a whistle stop, and I'm really happy for you to ask me questions. Let me see. Well, that was quite quick. Is that too quick? I think I get more value probably from hearing what your concerns are, whether it's about the Encompass program or anything else that we've chatted about. Thank you.
Thank you, Pippa. That was absolutely fantastic. I've learned quite a bit there myself. And I thought, oh, there's maybe just Florence and there's maybe just Armed, and but there's a lot more out there than and I knew about Orca, but as I said, a lot more things that I didn't know about.
That's good, because when we chatted, Anne-Marie, I thought you knew everything and I had very little. And to be honest, those things they're still very in their infancy, but it just gives options, doesn't it?
And as I said, I know personal. My video's going off and dodgy things here happen on my computer. But I know that whenever I had looked, from a falls perspective at, my patient portal, there wasn't any information on falls actually on the patient portal. And I just wonder, is there work going on to look at regionally what should be on that, to be accessible for patients?
Yeah, you can inform that, Anne-Marie. So if you think that it is going to be useful to your patients, so we had done it for lymphedema as a regional network. We decided that the information that we wanted for patients to be able to access was this, and this, and then we gave that to the person who's on that. Anne Mulgrew manages the patient portal. So if it's something that you think would be useful, you can completely inform what goes on there. Across the region. You would just need to make sure that, and they do like it if you can do it regionally.
No, as I said, that's grand. It'll be something that we can talk about as regional coordinators. And I see now just a few questions there in the chat box.
Yes, I can too, and I definitely agree with you. So the GPs are the sticking issue with Encompass, and they always have been, because their systems are really very up to date, and they did a big move across to EMIS Vision and Murloc not that long ago. So when Encompass was being talked about, they were like, no, thanks very much, but we're fine with what we've got. So the other side of that coin is that they have not given it a definitive no. It's just that they kind of want to see how we get on with it as well. So I could envisage in the future, it may be something that when they see how it works, it would go out to them. But at the moment, they will just have the read-only view.
Okay.
Their referrals should come into it the same way they would using CCG. So they will have connectivity to it, but what's really frustrating is for the ones that say, actually, no, we don't look at NICR, we need the information to be sent directly to us and we scan it into our system. That's still the case.
Yeah, because I know that I'm just thinking, how would it interface? Because I'm talking specifically again around falls, and it would be the elemental system would be what the healthy living centres are using.
Yeah.
And we would make onward referrals and work in partnership with them, as well as with the council home safety officers, where we do like paper referrals and scan email them across to the healthy living centres. But I just wonder, will there be an interface there to link with the council services and healthy living centres? And I did ask John whenever I was on the call about that, but we didn't have an answer in that one just yet.
Yeah, and that's really good thing to raise, actually, Anne-Marie, because The Encompass program is just so vast that there are hundreds of those kind of questions that are out there. And it's not that we can't do that. You know, we potentially could have an electronic interface. It's just how many they are and when we get to them. So I would say that a lot of these things won't be available at Go Live. They probably, you'll be able to probably generate the referral within the system, but if there's not the interface there, it still will be a print and a send or email, depending on what's at the other end.
Yeah, because I just know, you know, at the beginning of the program and at the end, the physios would do outcome measures, and it's just they would be used to evaluate how somebody's progressed on the program, and it would be just useful if somebody was referred back into your service, you could see this person has already been referred to the Stepping On program. It's a 9-week program. They've attended 2 out of the 9 weeks.
Yeah.
This was their outcome measures at the beginning. This is outcome measures at the end. You know, because it could actually save time, because you could be they'll agree to, you know, the referral at the time, but they may not, you know, engage with it very well. And it's just, it could support, you know, conversations around compliance and motivation and things like that too.
Yeah, definitely could.
I'm just giving a reminder to everyone, if you want to turn on your cameras and ask any questions, feel free, or if you want to write if you don't want to talk, you can write your questions in the chat.
Kerry, I'm just going to check with you. Did I answer that question enough? Will the interface with GPs work both ways? So there will be, they currently have a feed into NIECR that you'll see. So you'll get the key information summary from the GP system in NIECR, and that should be the same for Encompass. So there should be a key information summary brought across from the GP system, as far as I'm aware. That's the plan. And then, yes, they will be able to see what we put into it. So it should be very similar to what it is now.
Yeah, that only works though when they actually have ECR. Yeah. Well, a lot of them, I didn't realize they had to pay for it. So a lot of GPs won't pay for ECR, and that's why they don't have it. Yeah, apparently so. That was news to me, because I just assumed all of them had it. They just chose whether or not to use it or not use it.
That's
and some
really
of them said no.
news to me.
Yeah. No. Maybe that was just the excuse they give me.
I would question that. I did sit on an ACR steering group, and I know that there is a permissions process to go through to get access to it, but I didn't know that there was money involved. That would seem strange to me.
Yeah, that was, well, yeah, that's what the GPs give to us. But I'm just thinking for the ones that don't, if it's going to automatically be there, but if they have to actually, they obviously won't have to pay for Encompass. It will be there. It's just whether or not they choose to look at it.
And there should be, within their system, there should be a button that takes it to them. So they shouldn't have to come out and log into something different. It should be a run through. And the other thing is that I kind of feel like everything's going to be in there. So at some point, like to get any information about any patient in Northern Ireland, they're going to have to go on to Encompass.
Yeah.
So you kind of feel like eventually they should get that message. But having experience being with GPs in the current group that we have within Encompass, I don't hold up that much hope.
No.
Oh, hang on, I'm just remembering this is being recorded. You might want to take this bit off. Oh dear.
But can I just check, will it replace you know, your eNISAT as well, you know, the social work?
Yes.
Yeah.
Currently that is all in scope to be replaced.
Okay.
It may well just be rebuilt in Encompass, but hopefully it will be improved upon in the process too. Can I see, are many of you on Encompass groups?
I'm on the one in the Western Trust for Falls, but I just find it quite challenging because, you know, the other trusts have, like, as in maybe multidisciplinary teams that, you know, assess patients with falls, and I'm working in partnership with other teams, as in, you know, onward referrals to the physio, core physio and core OT and falls OT,
Okay.
you know.
And that's
which
where
means-
that standardization is really difficult, because
yes,
we
it
do it
is.
so differently. And ECA will be the same, Wendy. There will be a lot, and intermediate care is an absolute variation across lots of different places. So that's where this is really, really hard. It's the right thing to do, to design it for everybody, but it's very difficult to do that in practice.
Yeah, because we're even undergoing restructuring, and currently I sit under secondary care, but under the new consultation, the proposal is that I'm sitting in intermediate care, which is probably, I feel, the best place, you know, for me. But it's just, it's just the different ways that all the trusts are working, and there's no standardization, and it's getting the one system to fit everybody's needs.
Yeah. Whenever it gets tricky, I always try and take it back to the basics of what our documentation is, because that's what the system is doing. We're documenting our input on it. And the way the system is set up, it will have its professional groups, and then it will drop down to all the different assessments or interventions that you can provide, and you just pick the ones that you use and complete those, and then you can pull that across, and you can also see what other people have done. And if it's the same thing, if it's the same field, say temperature is taken by 3 different people, it will automatically show up what the other person has put in there. That makes sense.
Yes.
So that cross communication, even if we do things in different ways, the documentation at its very basic form should still be the same. So to me, that's a little bit of a positive. Yes, we do need, it is tricky to move through this bit, but if we can bring it back down to those really basic levels, we do similar things at the core of what we do.
That's it. Will it interface as well? You know, I'm thinking Northern Ireland Ambulance Service. You know, the referral forms, and you know, the assessments that Northern Ireland Ambulance Service carry out at point of service delivery.
Northern Ireland Ambulance Service is not in scope for Encompass, and so what they have historically done, and I think they have looked at doing some kind of electronic records with it as a sort of project on their own, and they weren't ever included in the scope for Encompass. So it'd be interesting, Anne-Marie, to understand what it is that they do that then comes through to you. And I have a tiny bit of knowledge of that, but not enough to be able to answer the question correctly. And it may be different in different trusts as well, possibly.
Yeah, and I would like to say, you know, at the minute, as I said, if they, in relation just to falls on its own, whenever they respond to a call out and the decision's made not to transport somebody to hospital, they're referring them into as a central point of contact for falls within each trust. Now, what each trust delivers after that is a different sort of scenario.
And how do they refer? How do they do that referral?
They are doing an email referral to our Opal's inbox.
Okay.
That's the way that the referral system's coming through. And now I was actually speaking to Chris recently, and his plan is to refer everybody that doesn't be transported to hospital. And because of the structure of our service, I says, you know, there's a lot of people, you know, maybe palliative or terminally ill, and it's not appropriate. So it's actually wasting a lot of time. So there's a meeting at the end of the month to actually look at the referral criteria, and you know, for the documentation for Northern Ireland Ambulance Service to refer into fall services. So if it's on the 30th and I'm off on annual leave, but I've, you know, sent an email basically of what I think needs to be considered, you know, and at that meeting.
Yeah, which sounds very sensible. And I don't think that will change. Probably it will still come through, but it may be into an inbox within Encompass that then you can use to triage. And one thing that will be easier, I think, will be that triaging process, because you'll be able to have all of the patient information in one place for you to actually, that is a palliative patient, they're not going to be appropriate. You won't have to try and find that in lots of different places.
Yeah. And it's building even frailty screening as well, isn't it?
Yeah.
So, you know, you can see somebody's frailty journey the whole way through from a
Mhm.
care of the elderly perspective.
Yeah.
I was just going to say, from a triage perspective, I'm sort of hoping that it'll really help us. I work in the community rehab team, and whenever we're triaging, you know, we're looking at various different systems. You know, we've got ECR open, we've got scheduler open, we've got NISAD open, we've got the reports. You've got like about 4 or 5 systems all open. So yes, I'm sort of hopeful that Encompass might help that to some degree. Pippa,
I am
or
too,
can you
Julie.
give me some hope there?
Yeah, I can. I definitely think it will. I think the patient storyboard that appears on the left-hand side that has a lovely summary and has also sort of like any key flags or anything like that. And then you've also got your social determinants of health wheel that will flag if you've got any, you know, poverty or care involvement, or you can connect up all the different bits of the family as well. That overview of the patient, I think, will be so much clearer in this system than we've ever had before. So I think that is probably one of the key areas that will improve. How long it will take to populate that, I am not sure of, because there will be a data migration piece. So we will bring some information through from systems, but I think there will be a period of time where we build up that information in the system. Yeah.
Okay. All right. Well, it's in the pipeline.
In the pipeline.
Good
Just
job.
keep thinking what we're doing for like our children who work in health and social care. Eventually it'll be great by the time they get there.
I probably will have retired by the time it's out.
I know. Yeah. The other thing that I really, really love within the system is just the shortcuts and the efficiency. That piece around having to write something and then type a discharge letter, and that just becomes a breeze. So the flow sheets that I'm talking about, you might fill in the fact that, you know, a patient takes assistance of 1 and they use a wheel Zimmer frame, and you might do that on their initial assessment, and then you might do it on the end. At their final assessment, and all of that information can be moved. You can just do a template that pulls that information into a summary.
Okay.
And that summary is then what you'll use for your onward referral for eNISAD. And if we build it correctly, we don't have to do everything again. It will just pre-populate with the information that you've already put in as part of your treatment.
Perfect. Okay.
And I was in Manchester last week shadowing their go live, and there was a physio on the ward who completed their flow sheet assessment and then was just populating a note into the record. And that was the bit that she just loved. She just pressed a button and she was like, oh, it's all there. And she used that .v for what the vitals were. And then you can do a .pm or something like that, and it pulls in the past medical history. And it just makes those things so much easier. And there's lots of different things you can do, like smart phrases, which Kerry, I will be getting you on very soon, that just create things that you do all the time and make them much shorter. Just pull in what you would normally do. Wendy's put me another question. Practice Encompass apps. You can look into and see how it's all set up. This is something that I think we haven't done enough of. So there's the workflow walkthroughs, Wendy, that are videos that were done a long time ago. And if you have the SET app, you may do SET Connect. You can get to them through there. You can also get to them through the Encompass website, I think. And they're basically just a list of videos. There's one for AHPs, there's one for nursing and AHPs in the home. They're not very quick, like you need to fast forward bits of them, but at least shows you what it's like and what it will look like. But I think we need more of that, and there will be more of it coming when we get to a year go live. We're hoping to do more demos, and then you'll find out more in the training as well. But the system, it's hard. They don't want to show us too much of the UK foundation system because it doesn't look like what we will eventually use. So they're a little bit cautious about giving lots of demos, but I think we need to see it. You need to know what it's like to be able to picture how it's going to work for us. So there's some videos there, but more to come.
Pippa, one question. Does that mean that in an acute hospital, there won't be any more physical notes? It'll be all to be done. Oh, that's great.
No, no paper is the plan. All typed.
Will it link in with your DATEX and incident reporting systems as well for, no?
No, that's a separate thing and it's staying there.
Yeah.
You have to, I always have to keep coming back to the fact that it's a patient record. So everything is aligned to it. Even, do you know, some of our dietetics would do webinars around population health, and you can't pin them into an individual patient because it's to people that you don't necessarily know. It's just out to the general public. So that kind of information can't be put into this. It needs, everything that you put into it has to be aligned to a specific patient. Now you might get that in DATEX, but you might not as well. It might be more around the environment or something. So this needs to be very aligned to the patient.
Can I just ask, you see my my care portal?
Yes.
You say that we can access that at the minute, even like, so saying, because I'm just thinking on a recent experience through the hospital where I had bloods done at an outpatient clinic, and you phone your GP and no, they were done at the hospital, so don't have access those. And then you phone the hospital and try to get
through.
And you can't, you know, it's not my response, you know, I can't tell you because the consultant hasn't looked at them. And
yeah.
Of course, if I could have just accessed it, I could see my own blood results.
Yeah, I did exactly the same. You have to be onboarded by a clinician. So you need to ask and they need to be aware of it. But so technically, if you want on to NIECR tomorrow and look yourself up, Anne-Marie, which we're not allowed to do, you can.
I know that. You're not allowed to do, you say.
Not allowed to do it, but it is there. That's what I mean. It is right there and available.
Yeah.
You need to be onboarded by a clinician who knows what it is to be able to do it.
Because I actually spoke to the GP practice and they hadn't a clue what it was talking about, you know, about my care portal. I didn't know what it was.
And I guess from a GP point of view, they won't, because it's a secondary care community. Yes. It's HSC rather than GP. But HSC probably won't know either. It's very pocketed at the moment as to who's currently using it. It's used a lot in diabetes. It's used some in orthopedics, used in lymphedema. So yeah, it depends really where they have been working. And for that reason as well, it may be that your blood results may not be released to the portal because that is clinically led too. So it depends.
It depends on whether your consultant releases them to you.
Yes.
That's the other side. No, that's interesting to know. Like, but you just thought yourself, such a lot of waste of time, you know, going around in circles.
Absolutely.
To get that information.
That's really key, isn't it, when we're talking to our patients about Encompass coming as well. It will make their lives easier.
And we have here another question, probably our last question. Thank Sandra Crawford. Thank you. It sounds very useful for triage. Will it pull in current medications from NIECR? So the way NIECR works is that it pulls medications from the GP record at the moment, and this should be the same. So anything that's currently in NIECR will be in Encompass with bells on. So the feed through should come from the GP system into Encompass. That sounds like it's a really easy thing to do. And according to my pharmacy colleagues, it's really not, because there's lots of different issues with pulling that information across. But the plan is, if it's currently in NIECR, it should be in Encompass as well. And also then if people are admitted, obviously their medications will be in Encompass, because they'll be verified once they get in, and all of the prescribing, there'll be no more Cardexes. They will all be on Encompass and put in electronically. Anyone have any other questions?
I'm just thinking, as I says, if there's medication changes made then in the hospital, it'll feed over then to the GP system and update the GP system, will it?
Should do. If they look at Encompass, but there should be, the way, you know, we have electronic document transfer at the moment. So if a discharge letter is created, that should go to the GP. That happens within patient centre, I think. the same will be with Encompass. So a discharge letter will be generated with Encompass, and then that should go to the GP, and that should have the medication update on it. And they have a really lovely thing called an after visit summary, which is a patient discharge summary, and it looks really great. They have like a little logo that says medication stopped, medication started, and all your instructions to do with that. And that's where I imagine that we will put in our, if they have any activity or exercises or goals that we want to try and achieve, it will go in there as well, and it's set out really nicely.
Very good, very good.
That's fantastic. So we'll close now, and thank you very much, Pippa, for the evening lecture. It was really
You're welcome. I hope it wasn't too broad and that there'll be something useful, but as I said, I will aim to make that presentation into a PDF that should then have the links attached to it. So if you press on any of the pictures, that will take you to the website that I've talked about.
okay. And we just wanted to give also a reminder to all the members attending today the evening lecture that, as you know, currently it's only Anne-Marie and me in the committee at present, and we haven't got any volunteers to join the committee. So we will urge everyone here, if you feel or you like to gain some experience, just to join the committee. We are not as bad as it looks, and we're very flexible regarding meeting times and everything. So I think if we don't get any answer by October, the committee will be disbanded until further notice. So thank you everyone for coming anyway.
Just like to encourage everybody, to join us. And if anybody even has anybody else that's not here tonight, if they could even spread the word, and just, email agile.northern-ireland@gmail.com, just with the expressions of interest. Very welcome and very flexible. Okay.
Okay.
Thanks, everybody.
Thank you. Thanks very much,
Thanks for coming.
everybody.
See
Thank
you.
you.
Bye.
Bye-bye.
Everyone.